Hi, everyone, and welcome to episode 119 of the Veterinary Behavior Chat. And today we're having another one of our super popular speed coaching sessions, which I will give you the rules to in a second. And joining me on today's speed coaching episode is a vet that I've actually worked with in the past, Dr. Lilla Balatonyi, who is a practicing vet from Hungary. I'm going to get her to introduce herself in a second. And we've actually got a case discussion, which I always love case discussions because they're so practical and it's kind of what we do every day. So welcome, Lilla. Lovely to have you here.
Thank you very much for having me. I graduated in Budapest, in the capital of Hungary, on our veterinary university in 2018. And I straight up started to work with cats and dogs. I still work as a clinician mostly, and I only work with cats and dogs, so no exotics. And in the past 5.5, almost 6 years, I started to get really into behavior, thanks to adopting a very reactive, fearful shelter dog, Sydney, who is now, I think she's not reactive at all. She's just a normal, lovely dog. But I learned through her a lot. And I also started to work with awesome trainers who opened my eyes to all kinds of perspectives of dog training and behavior. So I started to work on medication cases as well with a lot of help, actually, from your course, the psychoactive. So thank you for that information.
Welcome. Amazing. Okay, so we are going to do a case discussion in a second, and Lilla's going to ask the specific question that she has about the case. But before we get started, here are the rules of the 15-minute speed coaching episodes. So it's kind of off the cuff. We just do sort of a quick fire episode. It isn't massively prepared, so it's quite in the moment. However, I am absolutely setting a timer, and that's mainly to control me because I usually go over if given the opportunity. So I'm going to set my timer for exactly 15 minutes. And when the alarm goes off, that's it. So we sometimes kind of finish on a bit of a cliffhanger. We sometimes don't get to answer all the questions that maybe you have, but usually we make a pretty good inroad into discussing the case and answering kind of some of the big questions and how to maybe move forwards with the case. So those are the rules of the game. And as soon as you're ready, I'm going to press the start button, and then we'll have a 15-minute countdown.
I am ready. Thank you.
All righty. I'm pressing start now.
All right. So our case today will be Turbo. He is a 2-year-old neutered male Dachshund. He's like 6.5 kilograms, so sort of a small dog. And he was adopted by the owners in 2024, August, after they found him when he was hit by a car. Then he needed an acute abdominal surgery. So one of his kidneys was removed and also parts of his spleen. And also his left femur was broken.
Okay.
And in 2025, so this year spring and later this year in September, both femoral heads had an osteotomy. So both femoral heads had to be removed. There was arthrosis in both hips, and he was clearly limping and in pain. And Turbo has 2 owners, 2 grown-ups. There are no adults, no children in the household. And they live in a pretty rural, pretty calm area. The only downside is that there are a lot of houses with gardens, a lot of dogs barking at them constantly if they walk. So it makes walks really hard. And thankfully, Turbo's blood work and urine sample is clear. So there is no sign that the leftover kidney would not work perfectly. But there are some behavior issues with him, and I do suspect there is some chronic pain going on still in his life. So there is still some recurring limping, especially after wild movements or playing ball games with the family. Some extra vocalization, and that's what really bothers the owners, because Turbo is barking at everything. He's barking at home, barking outside at every single moving target. He's also very hyper vigilant, hyper aroused, like looking at the next threat coming on the walk. And if he starts barking, very often it turns into this choking himself with the leash, pulling like crazy, not being able to calm down. And when I met the owner, Turbo was already on gabapentin. They were giving him like 2 times a day, about 50 milligram per kilogram. So really on the high dose of gabapentin, but only 2 times a day. and they placed him on tramadol because they were afraid to use any non-steroids or anything that would affect the kidneys. But I told them I'm concerned that tramadol and gabapentin, the two together, is not good for his pain relief.
Yeah.
So this would be the first thing that I was thinking that we could chat through. I already suggested to them to try Galliprant or Grapiprant and to give gabapentin 3 times daily, maybe 30, 40 milligram per kilogram. They said they did not see much change with this, to be honest.
Okay.
So my next thought would be to go with maybe Librela and amantadine for the pain control. Yeah. But also I would be very interested in your opinion, like, do you have any experience with what if a dog only has one kidney, but that kidney works fine? Are we good with non-steroids, or should we try different painkillers?
Yeah, it's a good question. And I think the first thing we probably have to think about is like, what type of pain do we think he's experiencing? And I think just from the history, potentially 2 types. So we probably have inflammatory pain, right, from his osteoarthritis, potentially what was going on with his hips. But then I think secondarily, potentially, we also have like a wind-up central sensitization, hyperesthesia, maybe now from maybe the post-surgical pain that wasn't managed adequately. So when we think about the 2 types of pain, I guess then we're kind of thinking, well, what can we use to target each of those types of pain? And look, I agree, his kidneys are working fine. Do we have to risk a non-steroidal if we have other options? Is his liver fine?
Yes, the liver is, everything is good.
Okay, so I would maybe so the Grabiprant is the first thing that I would perhaps continue. So if I'm thinking about like the inflammatory pain, maybe sort of the osteoarthritic pain, musculoskeletal pain, then the Galliprant or Grabiprant and the maybe paracetamol and maybe Librela. Those 3 are potentially things that I might be thinking about. Potentially also something like acupuncture. I don't know if you guys have access to acupuncture or other sort of modalities of physiotherapy.
Yeah. Oh, yeah. I also suggested to start physiotherapy. Right now, he's not loving it. He's a bit stressed about the physiotherapist's personality, or like the person itself being so close to him. But they're working on it with the trainer to make sure that he's okay. They also placed mats on the floor, so he's not sleeping around in the house.
Yeah. And then also we have to think that he's a Dachshund, right? So we always have to be very mindful of any potential spinal issues that could come secondarily to what has already happened, especially if he has weak hips and a propensity towards musculoskeletal pain. So those are the things I'd be thinking about there. Maybe laser therapy, that's maybe less invasive than some of the more hands-on physiotherapy that you can maybe do from a distance. Look, some of these things don't have a great evidence base. So then it's always a little, right? Like you're like, yes, we can try. We also don't perhaps have long-term evidence with Librela and potential impaired kidney function. I know his bloods are great. However, we do have to be mindful of the fact that he only has 1 kidney. So those are just some of the limitations I'd be thinking about. So coming up with an analgesic plan that sort of takes into consideration some of the concerns we have while still addressing the sort of target pain pathways, if you like. So those would be my thoughts maybe for the inflammatory osteoarthritic pain. And then if we are thinking that there might be central sensitization wind up, then I agree, something like, so gabapentin, memantine, or amantadine. The Librela also works on those higher centers of processing, so that could have a dual effect, although it's only licensed for osteoarthritis. But yeah, those would be some of the things I would be thinking of. So, I mean, we actually have quite a few medications that we haven't yet gotten into. So there is definitely some option for increasing his pain management. And of course, you know, thinking about all the adjunctive, like not just the drugs, but everything else that we can do around that. So yeah, that would be my suggestion for pain.
And yeah, my second question would be, I think he's also a good candidate for psychopharmaceuticals. So
Yeah.
would you have a suggestion for that?
Yeah. And look, I think sometimes we have to ask ourselves, like, how much of the behavioral signs are related to the pain. We also don't know his history because he was kind of found at the point of this road traffic accident, which was likely quite traumatic. So I think, looking at all the ways in which we can calm his nervous system from a physical health point of view, but then also making sure that and I know that you've thought about all this, we're providing for all of his behavioral needs, all that sort of thing, avoiding triggers. If he's a 6 kilo Dachshund, does he have to go on walks, or is it possible to manage him without some of the triggering walks? So those sorts of behavioral approaches, I guess. But I think if we are thinking psychopharmacology might be helpful for him, then we'd want to be targeting something that also is going to affect the noradrenaline pathways. So for me, potentially a tricyclic antidepressant or venlafaxine would be the two that I'm thinking about if we're also thinking about managing his pain at the same time.
Mm-hmm. Yeah, thank you very much. Yeah, he's actually doing relaxation protocol also in the car. We try to make him used to the car, so he's pretty much cool with the car now. So they can just put him in the car, drive to meadow, walk with him there. So we are really trying to avoid the stressful situations, and slowly we are introducing him to the look at that game and pattern games where he looks down and then up and down and up, with gradually increasing the circumstances that could snap him out of this. He's also pretty good actually observing people and the environment from the car. So now we suggested to just park down in the edge of a parking lot of a shopping center or something, and from the distance just watch people, and he seemed to be good with that.
Yeah.
So
do you know, one of the things I absolutely love for that I found really successful in the past is using sniffing games as part of your patterns, or when you have them like at a distance observing the environment or observing triggers, is allowing them to observe and then helping them to decompress by offering snuffle mat games. So I'll often have clients bring a snuffle mat with them to wherever it is that they're going to do the observations, take a snuffle mat, and then have maybe even a couple of snuffle mats, start playing a pattern game with the snuffle mat. So moving from one snuffle mat to the other, while potentially, there are triggers far, far away, low intensity, big distance, and then doing like the pattern game with the snuffle mats, and then maybe having him just chill. If you're doing a chill protocol and there's maybe a bed that he likes to chill on, having that bed with the snuffle mat, and then just having him like observe, and then the caregivers put a few treats in the snuffle mat. He can snuffle for those, decompress, then kind of observe again, have the treats in the snuffle mat. So just so that we're building in this almost like therapy. We want to think about, like for us, we would say, breathing exercises. I think for dogs, they are a lot harder to teach on cue. You can, but for dogs, I always find things like the sniffing games, would be the equivalent of us like sitting somewhere, observing something that's stressing us and practicing mindfulness, relaxation, breathing exercises. So using the snuffle mat for things like that, I love doing that. That's so cool.
Oh, that's awesome. Thank you very much for the suggestion. I will write it down.
Yeah, that would be quite, especially because he's a Dachshund, so he probably quite likes using his nose and snuffling. Yeah,
actually his appetite is actually, that's where I was also thinking about, like, I wouldn't put him on fluoxetine because his appetite is like good. He likes treats, but not like this crazy big eater. Okay. So I don't know if you experience that with, for example, venlafaxine, that it lowers their appetite, or it's not
as much as fluoxetine, I think. I mean, look, we obviously have other SSRIs that we could consider, especially if his appetite is low. Things I might think about would be sertraline, or then maybe escitalopram. We don't have the benefits of the noradrenergic effects of those medications. So we would then be thinking those really for relieving his sort of generalized anxiety or stress state. but we wouldn't get probably not much in terms of beneficial effects from an analgesia point of view. But maybe if you get a really good pain medication protocol, you don't need that. And you could use something like sertraline or escitalopram that doesn't reduce his appetite as much.
And just, I think we run out of time, but just wanted to quickly ask back on the paracetamol. I don't have any experience with actually using it long term or like for weeks. Do you have experience with paracetamol for like 3-4 weeks or something?
We have experience with paracetamol for over months. It's a really, really effective analgesic. And sometimes we use it as a rescue analgesic. So we would have maybe our kind of baseline analgesic protocol. And if we feel we're having days where we have flare-ups or things are worse, we would add in a few days of paracetamol. And on other occasions, we would just use paracetamol. So our own dog, Polly, we lost her a couple of years ago now, but she was very arthritic, especially in the last sort of year, I would say, to 18 months of her life. And she really benefited a lot from paracetamol. I think with any chronic medication plan, especially if we're using polypharmacy, frequent blood's really important. Not necessarily because we think the drugs are going to damage the organs, but just so that we know if we have to do any dose adjustments, if there are any challenges to any organ systems. So at least every 6 months, maybe more frequently, I would be doing bloods on this little guy if he tolerates it well. Just to make sure we're staying safe and everything is kind of keeping in the good way.
Thank you very much. Then I think I got all my questions answered for this case.
We've got 1 minute left. That's amazing.
Oh my God.
That's so cool. See, we managed to do it in 14 minutes. I'm going to stop the timer. That's so cool. I love that.
Prepared my notes too.
Yeah, you were very thorough and very precise with the questions that you had. Oh, that's so good. I love talking about cases. It's literally my favorite thing to do. And what a story this little guy has had with the car accident and then being found by the owners and then all the surgical stuff that he's been through. So, yeah.
And actually, he was found by a veterinarian. So the owner is a veterinarian herself. So
typical.
It happened to the perfect owner. I mean,
I know, it's so typical. It's like, how you got into behavior because you yourself had a dog that was a little bit challenging. I know we all kind of have similar stories, I think.
Yes. Thank you very much for your insight on this case.
My pleasure. Alrighty, we will wrap it up there. That was a perfectly timed 15-minute speed coaching session. And to anyone listening, if you would like to know more about psychopharmacology, I will put the link to my psychoactive course in the show notes. If you'd like to be a guest on one of our speed coaching sessions, I'm also going to put the link to apply for that in the show notes. And I think that's probably everything in terms of show notes. But yeah, thank you so much for joining us. It's a pleasure to talk to you. And it's always a pleasure to chat through cases with you. I know we've done a couple together. So thank you so much for joining us. And thanks everyone for listening. And I look forward to seeing everyone next week for episode 120. Bye for now.
Bye.